Welcome to 2020. I'm your host, Woodwhacker Woody. Tonight's special is on joints. We have a plethora of experts with us tonight. Among them include John Smith, Stinkboy James, Dr. Watson, and Sven Svensson. And now for our next guest, John Smith. Straight out of Massachusetts University, he's going to talk to us today about joints.
Come on, John Smith.
Hi, I'm John Smith. I'm here to talk about joints. Joints are also called articulations. There are two functions of joints. They hold bones together and it gives the skeleton support. Every bone has a joint except the hyoid bone. There are two classifications of joints, functional and structural. Functional has three types of joints: synarthroses, amphiarthroses, and diarthroses. Diarthroses are limbs. Synarthroses and amphiarthroses are in the axial skeleton. Structural joints are also fibrous and cartilaginous joints. Fibrous are immovable, cartilaginous are freely movable and immovable. I also want to talk about fibrous joints. Fibrous joints are connected by fibrous tissue. An example would be the sutures of the bones. Irregular edges interlock and they are bound by fibrous connective tissue. There is also no movement.
Hi, I'm Sven Svensson, the second special guest, and I'm here to classify the different types of synovial joints by their shapes, starting with the hinge joint, which is essentially two curved interlocking joints. Then there's the pivot joint, which is a circular bone that rotates around a cylinder-like formation. Then there's the ball and socket, which is essentially self-explanatory. It consists of a ball joint and a socket joint. And then there's saddle joints, which resemble a bone interlocking with another saddle-like bone. And then there's condyloids, which are two curved joints interlocking like puzzle pieces. And finally, gliding joints, which just kind of rub together.
And now for our next guest, Dr. Watson, the most diseased doctor. Dr. Watson. Oh, I have to, okay.
Hello, I'm Dr. Watson. I may not be the world's most qualified doctor, but I am the world's most diseased doctor. When I was 12 years old, I fell on my knee. The fall caused my bursae to inflame, giving me a terrible case of bursitis. I've also got arthritis, which is joint inflammation. But saying I just have arthritis doesn't work for a man as interesting as me. I'll start with the most common form of arthritis, osteoarthritis. It's a chronic condition that typically affects the age. It affects the articular cartilage. The cartilage scars, frays, and eventually breaks down. The exposed bone thickens, and extra bone tissue called bone spurs. But I wouldn't be the world's most diseased man if I didn't have rheumatoid arthritis. It's a chronic inflammatory disorder that can affect any age. It also preys on women most of the time. The joints are usually affected in a symmetrical manner. Rheumatoid arthritis is also an autoimmune disease, meaning the body's immune system attempts to destroy its own tissue. Rheumatoid arthritis causes the synovial membrane to thicken into a penis that clings to and erodes articular cartilage. The last and my favorite form of arthritis is gouty arthritis. It's a disease in which uric acid accumulates in the blood and may be deposited as needle-shaped crystals into soft tissues of the joints. This leads to agonizingly painful attack that affects a single joint. This is the most common form of arthritis.
Tonight we have Stinkboy James. Stinkboy James?
Thanks, Woodwhacker Woody. Some bone injuries are too severe for regeneration to happen. Therefore, doctors use different techniques to fix the bone. Electrical stimulation dramatically increases the speed of healing and large fractures. bone implants are good for children because it resolves the problem of self-extendable endoprothesis. Vascular or endothelial growth factor is a protein that stimulates the growth of blood vessels. A lot of research has gone into developing bone substitutes, like crushed bone or synthetic materials to fill gaps. Bye.
Hello, Dr. Watson here. If you're wondering why my skin's transparent, that's because I've recently acquired a skin disease that makes my skin transparent. But that should be common for the world's most diseased man. Either way, that's not why we're here today. Today, we're here to talk about synovial joints, the most common and most movable joints in the body. The main feature that distinguishes synovial joints from fibrosis joints is the existence of a capsule surrounding the articulating surfaces of the synovial joints, and the presence of a synovial fluid inside those capsules. Also, in synovial joints, articular cartilage covers the ends of the bones, and joint surfaces are enclosed by a sleeve of fibrosis connective tissue. Also, a fibrous capsule is reinforced by ligaments.
I'm here today to talk about cartilaginous joints. These joints are made entirely of cartilage. They allow more movement between the bones than fibrous joints, but are less protective and strong. Sorry about that. On with cartilaginous joints. These types of joints form on long, immature bones and spiral vertebral discs. Known as cychondroses, bones are connected by hyaline cartilage and sometimes occur between. An ossification center is a section of fetal bone where cartilage cells are being created. Known as symphases, fibrocartilaginous. Examples would be the manubasternal joint between the manubasternum and the sternum, intervertebral discs, and the pubic symphysis. Thanks for watching. I've been your host, Woodwhacker Woody. Bon appetit. I got some, sorry.